Well, you know, by the way, that's me in the house where I grew up, in the yard where I grew up. Um, I'm playing with some of my mother's chickens. My mother started raising chickens in that house in 1946. She still lives in that house at 97, and she still has 20 chickens out there. So that gives you a little bit of a picture of my mother. She was the lady sitting next to me at the Red Sox game. I said, "Mother, when did you come here last?" She said, "Well, I think it was 1935. She says, "They've added a lot of seats in here." One comment, two comments. One, as I look through all the laureates, I have one distinction that I'm very proud of, and that is I'm the only doctor. Love it. Secondly, many years ago, Angus said to me, "Do you remember the scene where Tom Sawyer comes back after his mother thinks that he's died to his funeral and hears them saying all the wonderful things about him?" And as I watch that video, I feel like Tom Sawyer coming back after people think he was dead. Thank you very much, Erin, Michelle, the team at Junior Achievement, the selection committee, for this recognition. It's an honor to be here with you all tonight, and especially to join Ed McCursey and Kristen Maley as one of this year's laureates. Ed and Kristen, I just want to take a moment to thank you for the important work you do to promote both the economic and physical health of our community. Ed, connecting employers with the human resources they need to thrive, and promoting Maine as a vibrant place to work. Kristen, for your work ensuring food security for neighbors at risk in our communities. I am just so appreciative and respectful of the work you do. At Martin's Point, we share this emphasis on creating healthy, sustainable, flourishing communities, not only for today, but for future generations. As I prepared my comments for tonight's event, I realized that in my role as a physician and the leader of a not-for-profit healthcare organization, it's not often that I speak to a group whose mission is to promote entrepreneurship. It gave me an opportunity to reflect back on my own business education, the mentors I've been lucky to have, and some lessons learned as I traveled the path of ups and downs that's brought me to the very fortunate position of leading Martins Point Healthcare today. I grew up on Cape Cod, not the Cape Cod that immediately comes to mind for many of you with its motels and beaches, but when I grew up on Cape Cod, it was mostly pine woods and cranberry bogs. As a child of a small-town family doctor who has ran his practice out of our house, I learned early about the power of lasting patient relationships built not on money, but on trust and caring. As I was preparing my comments for tonight, I was speaking with someone about them, and they said, "Well, can you give a story about that?" And the story that comes immediately to mind is that in our little town of Yarmouth, we had a fellow who was a rough, tough contractor. Spear Holloway was his name. He probably weighed 275 pounds. He was a bundle of muscle. He liked to drink, and he did get into a lot of fights. Dad stitched him up over and over and over again and said, "Spear, you know, you got to kind of chill a little." My dad passed in the late 80s. And a couple of years ago, my mother heard a knock on the door, and she went to the house, and she said, "Spear Holloway, what are you doing here?" He says, "Well," he says, "I just came here to tell you, sorry that Doc died." Mother says, "But he died 30 years ago." He says, "Yes," he says, "I haven't been able to bring myself to drive by the house since then." And it spoke to us about what he meant, what Dad meant to the community. Following in Dad's footsteps, I got my medical degree and started a primary care practice in the small coastal town of Stonington, Maine. I served residents on the island of Deer Isle who are mainly clammers, fishermen, marine tradesmen, good people. Medical school in those days, as you could imagine, didn't have any business classes at all. in its curriculum. And so an awful lot of what I learned about building and growing my practice came from ambulance rides that I did with my patients. Yes, we did that. Every ambulance call, we rode in it. More importantly, home visits I made to patients who didn't have much, but knew me as somebody that they could trust with their care, their children's care, and as a member of their community. Trust isn't easily built, and it's something that endures. And remarkably, I'm still warmly greeted 30 years later when I returned to Stonington. I first joined Martins Point as a physician 30 years ago, a fact that's really hard for me to believe. It was a tiny place at that point with about 20 physicians, maybe 75 employees, and wasn't much different from the public health service that it had really grown out of. A couple of years after I got there, I was asked to lead the group as a practice medical director. As you can imagine, this is a great challenge, as leading doctors is tough work. I was able to find mentors like Dr. Gregory Cully, a skilled medical director and a man who understood the business of running a medical practice, who supported me in the work of creating a strong clinical organization. I'd been totally focused on providing care as a physician, but Martins Point also offered a health insurance plan. And here was a whole new field I needed to learn. It was a tall order, but I always came back to the lessons I learned from my father, the family doctor. Build relationships that will sustain the community, commit yourself to excellence, and find great people who can complement your knowledge and experience and help you to grow. And always try to do the right thing. In 1996, Martins Point found itself in a crisis, and it was at this point that I was asked to assume the role of CEO, a position for which my note says I was not well prepared. That's an understatement. A more unprepared person never ascended to the role of CEO. I accepted it because I believed in the potential of the organization to make a significant community impact. The day after I accepted the job, still reeling a bit, I went out for a walk and thought about the future of the organization. I started thinking about how to grow an organization that would provide compassionate, high-quality care, and how the two halves of our organization could potentially work together, our health plans and our healthcare providers, each doing their very best with a common goal of, instead of being the traditional adversaries that they so often are. I knew that we wanted to have a great workplace where our employees really enjoyed making a difference. At that point, we committed to facing our challenges and adapting to our environment. We needed to grow our health system if we wished to make an impact, so we merged with the Bowdoin Medical Group, an excellent group of clinicians who doubled our size overnight. Our core work had been caring for military families, but with the closing of bases in Maine, we needed to strengthen our health plan business. We began our Medicare Advantage plan in 2008, one of the first in Maine, just before the Affordable Care Act sharply reduced Medicare Advantage payments and forced us to really scramble to get to financial viability. In the last few years, we've grown rapidly, but have become very concerned about the challenges of the frail elderly living in their homes, and so have started a home care program to assist them in meeting their needs and remaining safe and comfortable and healthy at home. We're now a healthcare organization that is operating in a position of strength, with a wonderful reputation for service delivered by a team that truly sees themselves as people taking care of people. I've learned a lot of lessons along the way. For me, first, the greatest risks often represent the greatest opportunities. Trust your instincts, but lean on the expertise of others. Cultivate relationships. Expand your influence through partnerships. Be mission-driven. Take calculated risks and keep your eyes on the prize. Maybe the most important lesson I have learned is to ground all decisions in the pursuit of our mission. For me, being granted the privilege of leading a not-for-profit organization, that mission has always been to serve the health of our community. The path hasn't always been clear, but this mission has been my guiding light, and it's always shined in the lean years and the strong ones. I consider myself fortunate to lead such an impactful mission. Thank you again for recognizing me. I'm honored to be inducted into the Junior Achievement Hall of Fame.